Hello, this is Paul Hambleton with the Health and Wellness Show. Today we're going to talk about allergies, what causes them, and how to treat them. We're going to do this from the perspective of a naturopathic doctor. Today I have Ashlyn Lanigan with me. Welcome to the show.
Thank you, Paul.
So before we start off talking about allergies, I was wondering if you could tell us a little bit about how you got started in your field.
Well, I'd actually always planned on a career in the medical field. I did my Bachelor of Science at the University of Ottawa, and I had planned on applying to either medicine or physiotherapy when I was finished. I was very active. I played on a club sport team, I volunteered, and I also worked part-time while I was going to school. And I was pretty happy and healthy and on track, as my parents would say, for my career plan. And then all of a sudden, right before my exams in December, when I was in third year, I got pretty sick, and I ended up in the hospital. And then on and off for the next year, I was in and out of hospital, and I often needed IV fluids for severe dehydration. And the medical doctors who treated me could never figure out what was wrong and what was causing the problem. And they would often give me things that made me feel a lot better, and they got rid of the symptoms at the time. But the cause of my health issue was never the focus. And so after a bit of frustration, I decided to branch out, and I saw a naturopathic doctor. And she investigated the root cause of my illness and chose some treatments which aided my body to heal itself. And then after this, I stopped getting sick, and I never felt better. And that was sort of my aha moment for me that I should become a naturopathic doctor.
Terrific. That's a great story. And you had such personal expertise and experience in that you then, probably tell that story to many of your patients, and because they probably identify pretty clearly with what you've gone through, because many people have gone through a very similar type of situation.
That's very true.
So do you have a special area of expertise in your practice then?
Yeah. So as I mentioned, the sort of differentiating factor for naturopathic medicine from traditional medicine is that naturopathic medicine addresses the root cause of illness or imbalance in the body. And natural therapies are used which help the body to heal itself. Naturopathic medicine is a 4-year postgraduate doctorate program, and there's only 2 schools in Canada. But the college I went to, the Canadian College of Naturopathic Medicine in Toronto, and then Boucher Institute in Westminster, BC. And in clinical practice, I see a wide range of patients. So I see patients prior to birth and then on into old age, and I really love the challenge of having such a diverse patient base. But that being said, I do have a few areas of clinical focus. So one of them being women's health, as well as fertility and pediatrics. I also attend childbirth, and I provide physical and emotional support for birthing mothers and their partners. And this can include natural pain management as well. And I really find it wonderful to aid kind of in the whole process. So in the fertility and then supporting women throughout their pregnancies and then attending the births and treating the babies once they're born. I really like that process. So that's one of my areas of focus. I also spend a lot of time with mood disorders, so anxiety, depression, and even chronic fatigue. Another area I focus in is in sport medicine. And then finally, I do a ton of work with allergies. And this can include regulating the immune system to treat various conditions. And they can be anything from digestive concerns like irritable bowel, Crohn's, colitis, to seasonal allergies, or even multiple chemical sensitivities, or things like skin conditions, asthma, migraines. I could go on this list for forever. But allergies is a big portion of the patients that I see.
Well, I want to talk a bit more about that in just a moment, about allergies. So could you give us a little bit of background then on what has to happen in terms of your education and training? Because obviously you've trained to be a naturopathic doctor, but then it sounds like you're involved very specifically and in depth in a number of these fields. Could you give us a bit of a background on that?
Definitely. So apart from being a naturopathic doctor, I've received much additional training. So I'm also a naturopathic doula, and so that means I'm certified to attend childbirth. I have a certificate by the Nepali Corp for traditional Chinese medicine and acupuncture to treat infertility. I'm also certified to practice intravenous or IV therapy by the Board of Drugless Therapy Naturopathy in Ontario. I was a naturopathic sport medicine intern at the Robert Shad Naturopathic Clinic for a year. And I also did a satellite internship at a free naturopathic clinic in Toronto, which focused in mood disorders. That's where a lot of that specialty came from. And then I did as well another internship at a naturopathic clinic in Ottawa, which had a big focus in allergy testing and treatment, and that's sort of where that specialty came from.
You have quite a lot of expertise in a lot of areas, I would say.
Thanks, Paul.
That's terrific. So, in particular, the services then that you provide, could you give us a laundry list, so to speak, of what type of services that you would provide to different patients that would come to you?
Definitely. So as a naturopathic doctor, I practice all of our main modalities. So that includes botanical or plant-based medicine, traditional Chinese medicine and acupuncture, using natural health products. So these would be things like vitamins or probiotics, nutritional and lifestyle counseling, as well as homeopathy. And then through my additional certifications, I do quite a bit of biopuncture. So that would, an example of that might be a B12 injection or intravenous therapy, and then as well the doula care.
Great. So now moving on to allergies in particular. You know, a lot of, it's a broad topic. What would your definition of allergies be?
Yeah, so maybe I'll just start by going over the traditional definition of allergies, and I'll talk about how my definition is a little bit different.
Okay.
So the traditional definition of allergies are an immune reaction between an offending substance, and this is called an antigen, and it can be anything from a food, a chemical, or an inhalant. And the defense mechanism or antibody that our bodies produce to fight this offending substance. So it's basically the interaction between the antigen and the antibody.
Okay.
My definition of an allergy is somewhat broader, and it often goes by the term intolerance or sensitivity instead of allergy. And this can include many symptoms, such as digestive upset, irregular bowels, migraines, mood disorders such as anxiety, depression, or attention deficit disorders, skin conditions, so eczema, acne, hives, respiratory conditions such as asthma, low immunity and susceptibility to infections, and this is just to name a few. So it sort of branches out from when you would commonly think about the traditional definition of allergy, you might be thinking just about hives or nasal congestion or something like that. And these symptoms that I've mentioned, they can be associated with exposure to the offending substance, but they may not have that classic antibody-antigen reaction. And so for this reason, they might not show up on the conventional allergy test done by your medical doctor or your allergist.
So this is where we start to get into the area of what a naturopath would provide as opposed to what would be screened for at a medical doctor's facility.
Exactly.
So could you give us some examples then of different types of allergies under this broad range then that you've just discussed? What types of allergies there may be?
Definitely. So the two most common types of allergic responses that I encounter in practice are the acute or immunoglobulin E, so IgE, they're also referred to. And this is often the instant reaction, so this would be something like hives after exposure to a certain plant or swelling of the mouth or throat after eating a food like peanuts. And this type of allergy is more likely to show up on the traditional allergy test done by your medical doctor. But these allergies only make up a small proportion of what I would consider allergies. The other type of allergic reaction that I see are much more chronic reactions, and they're often not instantaneous after exposure to the reactant, and they're called immunoglobulin G or A, IgG or IgA reactions. And they're more commonly known as sensitivities or intolerances. And these tend to present as the conditions I mentioned earlier, so things like digestive concerns, migraines, skin, and so on.
Okay, great. That's very good that's providing a lot of clarity there. Now, is there a difference between what you see with adults who have allergies and children who have allergies?
This is such a great question, Paul. So many people believe that allergies occur mostly in children, or that infant and childhood allergies disappear with age.
That was my situation, just to interrupt. I believe I had allergies when I was a child, and then maybe I grew out of them, but I don't seem to have those symptoms. So
yeah,
go on.
That's really interesting. So I guess unfortunately this is not usually the case.
Okay.
So common childhood allergy symptoms are things like chronic earaches or ear infections, tonsillitis, colic, eczema, respiratory problems. And they may seem to be outgrown as kids age, but they often develop into more serious or more like deeper chronic problems later in life. So for example, infant eczema often develops into childhood asthma, which then as an adult develops into gastrointestinal problems. This is just one pattern, but I see this regularly in practice. And basically, we just see the allergy move from one organ system to another. So to answer your question, Paul, there's really little difference in the cause of the symptoms, but they may present, the allergy symptoms may present very differently in different stages of life.
Okay. So now, foods and their relation to allergies. Can you explain how that might affect somebody's allergies, what foods that they're eating?
Definitely. So this is another amazing question and something that I'm really passionate about. So allergies are very tightly linked to the foods that a person eats, and even the food that your mother ate before you were born, so during her pregnancy. So
Really?
Yeah, it's quite interesting. So the studies have been done that show overeating of certain foods, so eating a lot of foods during pregnancy, can often lead to food allergies in children. And it often is those foods that mothers are craving during their pregnancies that children tend to be allergic to. And there's also infants exposed to cow's milk either in the womb or in the first 6 months of life. And this includes breast milk. If the mother's drinking cow's milk and they're breastfed, these children are more likely to be allergic to cow's milk as well. Allergies can also develop when you eat the same foods all the time. So when a person is frequently exposed to the same type of food, the immune system can become overwhelmed, and they're more likely to develop an allergy to it. So, and even today, emphasis has really been placed on speeding up and sort of simplifying food preparation. And this has really led to an increasingly repetitious diet, which is generally heavy on things like dairy, wheat, corn, soy, tomatoes, and these are all commonly allergic foods for some people. So when it comes to nutrition, variety is really the spice of life, I guess, is the bottom line.
So now, if somebody does have an allergy related to food, or is there a relationship now with inflammation, either related to the food itself or in and of itself? And while you talk about inflammation, this is a different type of inflammation than when you're, banging your wrist or your ankle and there's swelling, right?
Yeah. Well, I guess yes and no. So I guess allergies actually create the inflammation in the body. And it's funny that you say that. So when you hit your wrist and you get swelling or a bruise, it's because you've injured yourself, and so your body is responding to that. And so inflammation really gets a bad rap as causing illness or causing disease, but really inflammation is just our body's way of protecting us against things that it feels are harming us. So another example might be, so it's November, you go down south to boost up your vitamin D and get away from the lovely weather we've been having lately, and maybe unknowingly you eat or drink something contaminated with a virus. And so you get awful diarrhea and gas and bloating and vomiting. You're essentially an Imodium commercial. And this is all inflammation, right? So the inflammation is necessary to clear the virus. So our immune system is creating that inflammation to help us fight the infection. And so the same is true when we expose our bodies to allergens. It's just the body constantly kind of creating inflammation to fight these. So they're very, very linked.
Okay. Now, is there a relation in any way to tonsils or the airway when you're talking about when you're talking about allergies?
Definitely. So our tonsils are the first line of defense against allergens, and they're capable of producing an immune response when they're exposed to antigens or the offending substance. So this includes increasing in size, and when our tonsils increase in size or swell up, that can affect speech, and it can also obstruct the airway, which is very serious, and then also it can cause things like infection or tonsillitis. So it's funny, I find it funny anyways, instead of listening to the body and investigating why our tonsils are swollen, what are we more likely to do? Conventionally, they're removed.
Right,
so it's kind of a bit crazy if you think about it, that the first line of defense in telling us that we're maybe creating an immune response against something, we sort of just get it out of there. So I think that's a bit crazy. But air quality, I want to mention as well, also plays a role in developing allergies. So air pollution or even smoking can predispose in developing allergies, and not just allergies to the chemicals in the air pollution or to the smoking, but also to other things like other environmental allergies or food. And if a mother is smoking during her pregnancy, her babies are 4 times as likely as babies born to a mother who's not smoking to develop allergies, and these, again, are just generalized allergies, not to tobacco or cigarette smoke.
Wow.
Mm-hmm.
So then you mentioned about tonsils and speech and the airway.
Right.
So how might that affect breathing and people sleeping, their quality of sleep, and interruption of sleep during the night?
Exactly. So allergies can be hugely detrimental and can have a hugely detrimental effect on breathing and sleep. So think about trying to sleep with swollen tonsils and how much more difficult it would be just to breathe. The inflammation created by allergies can also increase mucus production, and so this can result in nose and throat congestion, which often causes snoring. And then this snoring affects the sleep of anyone that might be joining you in bed. So it can have sort of an effect outside of your body as well. And then, as I mentioned earlier, allergies often present as breathing problems, such as asthma in children. So there's definitely a strong link between allergies, breathing, and sleep.
Okay. So now, with all of this having been said about allergies, how would you test for allergies if a patient came into your office? What would your first and second steps be?
Right. So if I suspect an allergic cause, I test for allergies generally in one of two ways. So if I suspect it to be a food allergy, I usually recommend the hypoallergenic diet for 3 weeks. And this diet includes excluding all of the commonly allergic foods. And so those are foods like wheat, dairy, nightshade vegetables, sugar, caffeine, alcohol, and so on. And then after 3 weeks, I recommend to start reintroducing the foods, but just reintroduce them one at a time and watch for any physical reactions or emotional reactions, I should mention as well, while you're reintroducing the foods. The issue with the diet is it's really essential to stick to it 100% to ensure that there's a strong reaction on when you reintroduce foods that you might be allergic to. So for patients who don't think they can adhere to the diet, or for patients with suspected environmental or chemical allergies, I generally recommend blood testing. So the blood testing that I do is either a simple finger prick blood test or a serum blood test, and I personally do both of these in clinic. And there's a difference between the testing, this type of allergy testing, to the kind which is commonly done by medical doctors or allergists. So conventional allergists do something called a scratch or a prick skin test. And this involves scratching a small amount of a potential allergen just underneath the skin, and then seeing if a red bump or a wheal develops. And the issue with this test is it only looks at the immunoglobulin E, or the IgE, like we talked about before, acute immune responses. And these generally release histamine, which is what's causing that wheal reaction. This test generally has good results with inhalant allergens, but the results are relatively poor with food or chemical allergens. And that being said, there are a lot of false positives and false negatives, and it tends to be strongly influenced by certain drugs, such as antihistamines and steroids. And most people who think they have allergies are already on these drugs before the testing is done. And then as well, for young children, especially under 2 years of age, they haven't built up enough antibodies, or their immune system hasn't developed enough to produce this physical wheal reaction. And so if you do get positive results from this skin prick test, the treatment which is recommended for this type of testing is generally immunosuppressant drugs. So these could be things like corticosteroids or antihistamines. And both of these things are suppressing the immune system, so they're obviously not treating the cause of the allergy. So instead, I do a blood allergy test, which includes IgE, which is tested in the conventional skin prick, and as well IgG and IgA. And this is a blood test versus a skin prick test. And it assesses the full spectrum of the immune reactions. And so different tests look at different allergies. For example, there are tests for inhaled allergens and for food allergens. And the tests determine whether the substance produces an immune response and to what extent that response is. And it's the immune response produced inside the body. So you don't actually need a physical reaction like a wheal.
Right.
And these tests tend to have very few false negatives. However, any test can have a false negative. So if I suspect there's an error, so if somebody tells me every time I drink a glass of milk, I feel sick, and then I do the food allergy test and milk doesn't come up there, what I will then have them do is avoid milk, for example, for 3 weeks, and then introduce it and see what reaction that they have. And so it's just sort of eliminating and reintroducing the certain specific foods that they feel like might not have come up as positive on that test. And so it's sort of obvious that getting the test is probably a bit easier for most people than adhering to the hypoallergenic diet for 3 weeks.
Right.
However, the test isn't covered under OHIP. And so although it is covered under a lot of extended health insurance plans, the cost for the testing varies, but it usually starts around $250. So it's relatively expensive for most people. So there's definitely pros and cons to doing blood testing versus hypoallergenic diet, but those are my the two things I use most commonly to test for allergies.
But if somebody's looking for a test, then certainly it's a more comprehensive test with more comprehensive
and much less subjective.
Right.
Mm-hmm.
Right.
Yeah.
So then if you are going to treat, so with the treatment, if somebody goes off of the foods for 3 weeks, when might I'd like you to describe your treatment, but the question I have in addition to that is, how soon might people recognize a change from having removed a food for 3 weeks and then reintroducing it after the 3 weeks?
Right. So usually what I do on the reintroduction schedule is what I recommend is so the first food you reintroduce, let's say, for example, you start reintroducing on day 1. So on day 1, you would eat that food. So let's use dairy again. So on day 1, you have milk, and I usually recommend that you drink the milk 3 times that day. So you might have milk with breakfast, milk with lunch, milk with dinner. And then at the end of the day, or throughout the day as well, I get them to record any symptoms that they notice during that day. And then for 2 days afterwards, I get them to take milk back out of the diet and then track any symptoms on those days as well. So it's usually most of the responses are within the first 24 hours, but it can occur within 48 to 72 hours as well.
And what would the symptoms be? What would they be noticing? What are some examples of what might happen?
Yeah, so most commonly it's digestive issues. So they notice their bowel movements change. They might have gas. They might have bloating. It can also be respiratory. So they might notice that their congestion that sort of seemed to disappear while on the hypoallergenic diet, that's back again. It could be migraines. I've had patients that were suffering from chronic migraines, daily migraines, who after eliminating their food allergies, the migraines are gone, and they have even a tiny bit of that food as an ingredient in something, and the migraines are back again. But it really is very different for almost everyone, and so it's hard to kind of generalize the symptoms, but those are probably the most common ones that I see.
Okay, so they should just be hyper aware, so to speak, of what changes that they're noticing from their normal routine over that period of time when they're reintroducing the foods. Anything else with regards to treatment? Or?
Yeah, I want to talk a bit more about treatment, but I wanted to mention, too, something I didn't say is with kids, a lot of the time behavioral issues, so ADHD or different things like that, can actually be allergies, and particularly food allergies. And so parents may notice when the kids are off of those foods, they're not noticing the same behavioral problems. And then when put back on those foods, they notice that attention span decreases and there's more problems at school and that sort of thing. So that's another common allergy symptom that I see. But I want to talk about treatment. So naturopathic treatment for allergies generally involves what I was talking about in avoiding the allergic triggers. And so with foods, that's relatively simple. However, with chemicals and with inhalants, like if they're environmental allergies, it tends to be harder unless you're going to move, which most people are not going to do. So what I do is I try to promote avoiding the allergic triggers as much as possible, and then I help to support natural immune regulation. And so, for example, if there's a food allergy for eggs, I'll recommend avoiding eggs, and then I create an individualized treatment strategy using the different naturopathic modalities to help to rebalance the immune system. So even if it's impossible to avoid the trigger, so if it's an environmental trigger, there's still lots that can be done to help rebalance the immune system so there isn't quite as strong a reaction each time.
Terrific. So having dealt with this issue of allergies, and assuming that people get treated and they don't have the symptoms and they don't have the causes in their life anymore, how can this contribute now to overall wellness?
Right. So Allergies can be a small nuisance for some people to fully debilitating for others. And the conventional treatment of suppressing the immune system to relieve the allergic responses, in my mind, this doesn't promote overall wellness. Instead, by addressing the cause of the allergies and supporting the body to rebalance the immune system, they're decreasing not only the symptoms from the inflammation, but their immune reactions are also decreased. So they're helping to sort of reset and rebalance the immune system. And as well, patients aren't dependent on immunosuppressant drugs, and they can really lead happy, healthier lives. And this is what I believe to be overall wellness.
Terrific. That's great. So with people who have allergies who want to know a little bit more, do you have a couple of tips that you could pass on to them?
Definitely. So my number one tip would be to go and see a naturopathic doctor. They can help you determine the cause of the allergies and help to treat each patient. And as naturopathic doctors, we treat each patient individually and will design a treatment strategy which is effective for each individual. And then the second tip I might have is to really educate yourself. So there's lots of great books out there. A couple examples might be the Complete Food Allergy Cookbook by Marilyn Giannani, or even Coping with Food Intolerances by Dick Tom is another great resource. So maybe don't take my word for it. There's lots of great resources out there which you can check out if you want more information about allergies.
Great. Now, if somebody were looking for a naturopathic doctor, what should they know or look for?
Yeah, so fortunately here in Ontario, we're one of the provinces where naturopathic medicine is very strictly regulated. So anyone calling themselves a naturopathic doctor in Ontario will have to have passed the North American and Ontario Medical Board examinations and also be a member in good standing of the provincial and national naturopathic associations. But that being said, not every province or state is regulated, so really be sure to look into this if you're listening from outside of Ontario. An example is in Quebec. Anyone can call themselves a naturopath and they can start practicing. So it's really important to do a bit of background if you're outside of Ontario.
Terrific. Well, Dr. Lanigan, I'd like to thank you very much for being on our show. Now, if listeners want to get in touch with you, how can they do that? What's the best way to do that?
Yes, thank you so much for having me, Paul. Listeners are more than welcome to email me. My email is al@ashland, which is spelled AISLINGND.com. So al@ashlandnd.com. Or they're welcome to contact either of my clinics. I practice in Mississauga at Erin Mills Optimum Health, and the phone number is 905-828-2015. And I also practice at Totem Life Science in Toronto, and the phone number for Totem is 416-979-2249.
Great. Once again, Dr. Lanigan, thank you very much for your time and expertise you've shared with us today.
Great, thank you.